Bismillahirrahmanirrahim. Assalamu alaikum rahmatullah. Here we have CT angio of the neck. This is 4 years old male baby who presented with pulsatile mass on the back of neck. Here we can see this is a bunch of the vessels on the back of neck, which is basically a vascular malformation. This malformation is being supplied by external carotid arteries on either side. Here we have common carotid artery, and there is a tortuous prominent size external carotid artery which supplies the vascular malformation posteriorly, and here is internal carotid artery on this side which enters into skull. Similarly, we can see that venous component is being drained into internal jugular vein, and multiple venous branches are also draining down into subclavian vein. Similarly, on contralateral side, we can see this is brachiocephalic trunk, common carotid artery, and we can see branches are leaving behind from external carotid artery into posterior vascular mass, from where we can see multiple venous channels are collectively draining into a large vein which comes and ultimately drain into internal jugular vein. Similarly, multiple veins contributes into relatively larger veins which ultimately drain into subclavian vein at the root of neck. So this is an example of large vascular malformation which is supplied by external carotid arteries from both sides and is being drained into internal jugular vein and subclavian veins on both sides of the neck. Here we can see prominent vessels along posterior aspect of the vertebral bodies, that is around posterior elements. Here we can see spinous processes. This is basically posterior external venous plexus of the vertebral bodies or spinal canal, and this posterior external venous plexus is also engorged as it communicates with overlying vascular malformation. And we can also see this posterior external venous plexus which communicates with overlying abnormal vascular malformation also communicates with internal venous plexus around thecal sac in epidural space. These are the vessels which communicates each other, and we can see prominent tortuous vessels within the bony canal, which is basically internal vertebral venous plexus, and this is posterior external vertebral venous plexus. Thank you very much. Assalamu alaikum wa rahmatullah.